Is learning the English language your toughest challenge yet? Become our student and get access to effective and free educational materials.
Have you been having any problems lately?
No, but the nurse at school says that I should have my blood pressure checked.
Do you have a history of high blood pressure?
No, I have never been told that I have high blood pressure.
High blood pressure is called the silent killer because it hardly ever has symptoms.
How do you check for high blood pressure?
We are going to use this cuff here, and it will give me a reading.
What do the numbers mean?
They tell me how much your heart is working at rest and when pumping blood.
Good. That will help me know how I am doing.
Right. Just take off your jacket and shirt. And lie down on that bed over there. That's right now. Just hold up your right arm, will you? Does this hurt?
No.
And this?
Yes, a bit. Ouch.
And do you feel anything when I do this?
Yes, that hurts quite a lot.
And you don't feel any pain anywhere else? In your legs, for example?
No, nothing.
Well, it's probably nothing serious. But I think we'd better have that shoulder x-rayed. We can't do the until the morning, though. So it'd be better if you stay in hospital for the night. What's wrong with you?
I have a sore throat and headache.
Do you feel tired?
Yes, my whole body feels weak. And I really feel terrible.
I'm sorry to hear that. I'll have to examine you.
Okay, go ahead.
Open your mouth and show me your tongue. Say, "Ah, you have a bad cold. So you must stay in bed for a week." How do I use this adhesive?
This is a special adhesive for easing the pain. Apply it to the painful area and change it in every 2 days.
How do I use the lotion?
Apply some of the ointment, and rub it into the skin.
Well, thanks very much.
Not at all. You look a bit under the weather.
I am not feeling all the great. I think I have that crud that is going around.
I know that it's going around the dorms.
My boyfriend hasn't been feeling so well. Maybe he passed it on to me.
I have some cold tablets if you would like one.
Mostly, I feel like I need some rest and hot soup.
Drinking liquids and getting rest is a good idea with a cold.
My grandmother thinks that honey and whiskey is a good cure for a cold.
You could always go to the pharmacy if it gets worse and you want suggestions.
If things don't get better in a few days, I will look for some other solutions. Now tell me, what's your problem?
I don't feel like eating. And I cannot sleep well.
Do you have a fever?
Yes, a low fever. I feel terrible. Am I dying?
Certainly not. Take one of these white pills 3 times a day.
Before the meals or after the meals?
After the meals. And do not forget to take 2 sleeping pills before going to bed. My wife is in labor.
Here, ma'am, please get on the stretcher.
Is Dr. Hawkins here? She's our doctor. We called her from the car.
Calm down, sir. We'll call her to make sure she's on the way.
Thanks. Sorry. It just came as such a surprise. The baby isn't due for another 2 weeks.
How long has she been in labor?
About 15 minutes.
Okay, are you planning on being in the delivery room, sir?
Yes.
Please follow the nurse. She'll get you ready.
Can I get some medicine to help me?
For your high blood pressure, we have several choices of medications.
What types of drugs can I try?
Hydrochlorothiazide is a diuretic that helps you with water retention.
What about side effects from that medication?
Most people have no side effects. You will have to make sure that you drink plenty of liquids with this medication.
Do I only need to take that one drug?
I am going to add a second drug for now, lisinopril, which is an ACE inhibitor.
What can I expect when I take that medication?
You will feel much better except for the fact that you might have a little cough.
Is there anything I can do for you?
Do you have Chinese medicine here?
Yes. We have herb medicine and ready-made medicine.
Can I have this prescription filled here?
Sorry, sir. The Angelica is out of stock now.
Become our student and get access to effective and free educational materials.